have to continue to require masks for anybody, when you're not in a room by yourself or able to social distance throughout the facility. We continue to provide masks and make those available at all of our entrances. Our patient parking and patient entrance continues to be on the east side of the building near the emergency room. We also continue to have a screener stationed near the patient entrance. We are working out the fine details of the process, but sometime in the next couple of weeks, we are also going to actually be resuming an actual screening process for all patients and visitors who come into the facility, and this is based on CMS guidance. We stopped asking questions for people when they came into the facility for some period of time, but based on CMS guidance that has come out as a hospital facility, we do need to be continuing to ask those questions. So that will include understanding which department you will be visiting during your visit to our facility, and also whether you are currently having any COVID-19 symptoms. We will also continue to have temperature kiosks available in the facility for public use, although you will not be required to take your temperature upon entrance into the facility. But you do need to wear your mask again. So please be aware that when you come into the hospital for an appointment or other business, you will need to stop at the screener desk and expect to answer just a few questions, just so we can make sure that we're taking those steps to help keep everybody safe and follow the rules and precautions that we're required to as a healthcare facility. Finally, as most of you are aware, Congress recently passed the American Rescue Plan Act. And as a healthcare organization, the Winnebago Comprehensive Healthcare System will receive an allocation that is separate from the tribe. So far, the funds that we have received are designated through that funding source for 5 specific areas. And those include number 1, lost revenue replacement; number 2, healthcare services and PRC, which is also known as contract health; number 3, information technology and telehealth; number 4, vaccine planning, distribution, monitoring, and tracking; and number 5, testing, contact tracing, monitoring, and mitigation for COVID-19. So we are in the process now of assessing all of these different areas so that we can maximize the use of these funds. And our goal is to, of course, meet our short-term needs in responding to the pandemic, but also trying to do the best that we can to maximize long-term benefit for our organization and to meet all of the healthcare needs that we have in our community. So these plans will be developed and refined over the course of the coming weeks, but we have not yet made any final decisions on the specific use of these funds. But as we go further into that process, we will be sharing more information about how the funds will be utilized. We are very appreciative of the fact that these resources have been made available to us and throughout the country, and we know that it's going to provide a great benefit for us and the patients and clients that we serve. And now I will turn it over to Mona for her remarks and today's COVID-19 data report. Thank you.
All right, thank you, Danelle, Tori, Emily. It's also very exciting to see all the events and activities starting to open. Of course, like Danelle described and Tori, that we still have to be mindful, especially with the variants. But our vaccines are obviously the best protection that we have. The vaccine clinics still continue on Wednesday. We do try to adapt to others. So if you're unable to make it on Wednesday, you just need to let us know so we can try to figure out a different date. As Danelle just described, we were trying to meet the accommodations of some people that reached out to us today and last night. And so we had some vaccines available today for people that wanted to stop in. And of course, but those have to be arranged a little bit beforehand. Not too much, but enough to get us a nurse and some arrange with the pharmacy. So we are doing the best that we can. We are excited also to have our vaccination rate up to 67% of our 12 and older have at least one vaccine. So it's very exciting to see our young people coming out and wanting to get their vaccination to be a part of the solution. The Winnebago Public Health Department has many things going on this summer with the virtual walk with the Whirling Thunder Wellness Center. Health Promotions and Outreach is doing a blood drive in June. And then, of course, the health promotions and education programs also doing a health fair in July. And so there's many other activities coming on. So make sure you keep an eye on the Winnebago Public Health Department's Facebook page, because all of our activities and updates are there. So with that, I will start the presentation. So this week's current COVID-19 dashboard indicates that we've had no new positives since the last report, which was last week, where we also reported we didn't have any new positives, or no active cases. We've had 356 positive cases, 5 deaths, 351 cases that have been recovered, and no one in quarantine. We have given 2,470 first doses of vaccine in Winnebago, 2,241 boosters, which is the second dose. So a total of 4,711 vaccines administered. So this is just showing the breakdown of cases in Winnebago since April of last year. So you can see from the pie chart here that 27% of our cases have been in the 20 to 29 years of age, and then followed by 26% of the 0 to 19 years of age. And then our 30 to 39 make up 16% of our cases. And roughly females have been 54% of our positive cases, and males being 46%. So since we started the vaccines on January 3rd for the community, 30% of our positives have come from our 0 to 19 years of age, followed by 24% from our 20 to 29 years of age, and then 16% from our 40 to 49 years of age. And then the genders are pretty much similar to what I showed earlier, which is 56% have been female and 44% are male. So this is just showing from April of last year until today that the majority of our cases, 192, have been linked to an initial case. So those are close contacts, usually within the same household. And then we've had 164 isolated cases. So this is just showing where the positive cases have been exposed from, starting from last year with 192, like we said, with close contacts, 92 from social gatherings, and 48 from family gatherings, and about 20 that have come from other areas, as you can see from the graph. So this is starting from this year when we started the vaccinations. So 22 have been from within households, close contacts, and then 22 have been from social gatherings, and then 5 from family gatherings, and 1 from incarceration. So this is just the positive cases over time, and so you can see the peak and valleys.
Maybe she's still talking. I run down her. Hold on.
Like we're experiencing some technical difficulties with our internet connection.
Yes. While we wait for Mona, I think we're, as Danielle mentioned, are experiencing some technical difficulties with our internet. I will go ahead and move to the next segment, which is an update from the Winnebago Public School. Dan Farringer could not be here today to give an update, but he did send an update in place. So I'm going to go ahead and read that off from him. So this is an up. Oh, yes, Mona, you're back.
I called on the phone. I'm sorry.
Oh, that's okay. Do you want to go ahead and finish your presentation? I was going to give Dan's update, but you can go ahead and pick up where we left off.
Okay. So did you hear me about the cases over time?
If you just want to start with the cases over time, I think you were cutting out.
All right. I'm so sorry. Internet problems. So anyways, so this just shows the cases from April of last year to present, and you can see the peaks and valleys with some of the holidays that were associated, but then you can see in January when we started to vaccinate where it really has gone down since then. Okay. And then you can see.
There you go.
Okay. So this is, I'm sorry, excuse me. Since January, when we started having our vaccinations, we've had 4 fully vaccinated people that have been positive, 1 that had their initial shot, and then 45 that have been not vaccinated. This is just showing the vaccination data as of last Wednesday, so not yesterday. And so this is the breakdown for the total amount of people that have come to the vaccination clinics. So 20% have been from the 19 to 29 years of age, and then followed by the 50 to 59 years of age with 16%, and then both 15% have come from the 40 to 49 and 30 to 39. And then our vaccinated genders, 56% are female and 44% are male. So this information is just showing the unvaccinated population in Winnebago. So roughly about 28% is still from our 12 to 15 years of age, followed by 25% of our 19 to 29 years of age, and then 15% from our 30 to 39 years of age. And then our genders are roughly about the same, with 51% being male and 49% being female.
Great. Alrighty, and that concludes our update from WCHS. As I mentioned before, Dan Farringer from Winnebago Public Schools was unable to attend today's recording, so I will go ahead and give an update that he sent along in his place. So he said the vaccination clinic is being held in the practice gym on Wednesday and is going well. The school will continue to host the clinic until the vaccination needs for the community are met. Session 1 summer school is underway through for K through 6 and is being held June 14th through July 1st. And that schedule is Monday through Thursday from 8:45 to 11:45. This week it's about 75 to 80 students per day that are attending. And Session 1 summer school extended school year for K through 8 students goes from 1 to 3, and that is from June 14th to July 2nd, Monday through Thursday. Session 2 will be held from July 12th through July 29, Monday through Thursday, and summer school for students in grades 7 through 12th will be held Monday through Friday, June 14th through July 2nd, and that is from 8:30 a.m. to 3 p.m. A second opportunity for kindergarten roundup will be for those that didn't make the first kindergarten roundup. And that session will be held Monday, June 21st from 9 to 12:30. And that will be in Mrs. Lang's kindergarten room at Winnebago Public School. Lunch will be served to the students in attendance, and parents can drop students off at the school and will be given the packets when students are dropped off. Questions can be answered when students are picked up at 12:30 that day. They will continue to keep the building and classrooms disinfected. They will continue wearing masks and using hand sanitizer and practicing social distancing when possible. Dan noted that it is imperative that health safety measures are practiced, and he wished everybody to stay safe. For more updates, you could like the Winnebago Public School on the Facebook page as well and follow along there for any urgent updates. We will now move on. We have today joining us from the Winnebago Powwow Committee, Les Painter, and he so graciously joined us to help give us an update as well. So Les, can you take it away?
Yes. Can you hear me?
Yes.
Well, I want to say thank you for asking the Winnebago Powwow Committee to participate in today's announcements, COVID update. And I was directed to come over here by the veterans. They had other obligations, and so I did ask them about, whether to if any of them wanted to participate in today, but they directed me to. So here we go. So this year's homecoming celebration is 155th annual, and one of the things that they added this year is to be you must be fully vaccinated to attend the 155th annual homecoming celebration on July 23rd and 25th, 2021. And usually we go 4 days, but this year the veterans got together amongst themselves and they talked about several different situations, 1 day, 2 day, 4 day, and they came up with a 3-day celebration. It kind of worked out in the veterans' favor because of the CDC and their lifting certain restrictions. So they decided to have the 3-day homecoming celebration. And they also weighed in on it being a contest powwow or a traditional powwow. There is a difference in between those, but they went with the regular contest homecoming celebration. So the grand entries will be 1 and 7 on Friday the 23rd, 1 and 7 on Saturday the 24th, and 25th there will be one grand entry in the afternoon. This year they're requiring all dancers and singers to present their COVID vaccination record card or their immunizations to participate, as well as making that a requirement for anyone to attend. Everybody is invited that's vaccinated. They gave they weighed those options also, and we're probably going to get into that question later, but they took everything into consideration and decided that it was best for the entire family, mainly the 11 and under, to participate, because there is no vaccination for the 11 and under, and they're less they were the less likely to contract COVID amongst our own statistics here in our community and nationwide. So being that they're in a home with parents that are vaccinated, and every adult, and now every 12-year-old 12 and older vaccinated, that would be the safest for them to attend the homecoming celebration this year. I know Whirling Thunder usually does a wilderness walk and run. This year it's a virtual walk and run, and I believe Mona mentioned it earlier, and maybe she's mentioned it before on the other updates. But that is put on by Whirling Thunder Wellness Program, and you can contact them through their Facebook, or you can go to the public health department or 12 Cleanse Facebook also to gain more information on their virtual walk run. This year it is you have to complete a 5K and a 7-mile walk, or a 1-mile run or 1-mile walk. Between July 1st and July 31st is the registration online at winnebagotribe.com. For this year's celebration, they've selected some head staff. I know that the Master of Ceremonies is one of them is Boy Lad from Albuquerque, New Mexico. Matthew Cleveland Jr., Silas Cleveland. Head dancers are head man dancers Alex Pelkey, and head lady is Brittany Pelkey. Arena directors are Pete Snowball and Isaac Smith. Of course, the host drums are Halushka New Breed. And we have 2 special invited drums this year. One is Motown and the other is Mandaree from Mandaree, North Dakota. Other than that, the Winnebago veterans are, like I said, they're extending an invite to anyone and everyone that is vaccinated, fully vaccinated. You have to be fully vaccinated to attend this year's homecoming celebration. There's they're going to have arts and crafts, food vendors, hopefully some sort of whatever you call normal is coming back. They are requiring you to wear your mask, wash your hands, and watch your distance. So that's pretty much the update on this year's celebration. So
Great, thank you, Les. And as we mentioned, this is the last week if you want to get fully vaccinated with the Pfizer vaccine before the homecoming celebration. You have to get the Pfizer vaccine this week. And as we heard earlier, there are some doses available at the hospital today. And you could also call the Winnebago Public Health Department at 402-878-2258 to get your vaccine this week. The fully vaccinated is 2 weeks post your second dose of the Pfizer vaccine. So that means that you have to start the series this week. And we will have some questions at the end related to the vaccine in powwow. So stay tuned for that. But next we will go to Manoj with an update from Little Priest Tribal College. Manoj?
Thank you, Emily. Good afternoon, everybody. Here's a quick update from Little Priest Tribal College. We had 10 graduates in May 2021 commencement. So we want to congratulate all our graduates. Our fall 2021 fall course schedule and our academic calendar is released. Starting this fall, all students, in the past was Title IV students, but starting this fall, all students are eligible for free classes, free textbooks. And if you're a new student to Little Priest, you get a free laptop as well. I cannot tell you enough how important this is for the community and to take advantage of this. So free classes, free textbooks. Another heart of the press news, the board has approved free student housing starting fall 2021. So, but for the student housing, there are some exclusions, there are some requirements, which we'll be sharing with the community very soon. But if you're interested, please call 402-878-2380 for more information. Again, free classes, free textbooks, free student housing at Little Priest Tribal College. We also update many of the things on our Highway 77 electronic sign. So please keep an eye on that for any updates, any news. We post our job openings at littlepriest.edu website. So we request the community to keep an eye if you're interested to visit littlepriest.edu. June 25th and July 22nd, the campus will be completely closed. June 25th and July 2nd, the campus will be closed. Last but not the least, I have a very exciting news. Yesterday at the board meeting, the Board of Trustees approved our strategic plan for the college 2021-2026, what we call Pathway to Success. So we have now a 5-year plan for the college starting July 1st, 2021. Here's a quick update from Little Prince Tribal College. Thank you.
Thank you, President Manoj. Now we will lastly go to Sam Burrish with an update from HCI. Sam?
All right, thank you, Emily, and good afternoon, Winnebago community. I have 3 brief updates to share. The first is Ho-Chunk Inc.'s Academic Scholarship Program is accepting applications now through June 30th. The PDF application and program information can be found on the Ho-Chunk Inc. website. If you have questions, please contact Terry Lee Medina at the corporate office. Again, the academic scholarship deadline is June 30th. My second update is on renewable energy. The U.S. Department of Energy recently published an article on the Winnebago community's renewable infrastructure and how that continued investment in solar helps the long-term effort for energy sovereignty. It's a really interesting article, and you can find the link on the Ho-Chunk Inc. Facebook page. Lastly, we have an exciting event coming up. I know a lot of you have been looking forward to the return of live horse racing at Atticad Park in South Sioux City. This year's live race day is Saturday, July 10th. You can enjoy live racing, wagering, and lots of fun. To learn more about the Atticad horse race, visit their Facebook page. That's Atticad SSC, Atticad SSC as in South Sioux City. I appreciate your time, and those are my updates for today.
Great, thank you, Sam. Lastly, we will move on to the question and answer portion of today's update. Thank you to all the community members who submitted questions to our Facebook page and emailed them to covid@winnebagotribe.com. We will begin by the first question, which a community member asked, how are we planning to enforce showing the vaccine cards at powwow? Since we have Les representing the powwow committee, Les, do you have an answer for that?
We are still talking and planning. As you know, it's going to be a I don't know, very important, difficult decision to. I think the toughest part is turning people away that aren't vaccinated. I know the veterans have they weighed in. We've been in several meetings talking about how and how we're going to do this, and for them, for the veterans, for the warriors, they're relying on the honor system. And I know that once you get vaccinated, everybody receives one of these vaccination cards, and they also it also goes on their vaccination records. So they will be requiring those to participate in the powwow or in the celebration, and in working with the health department and 12 clans, we will be there will be enough manpower to do that, and that's what it's going to require: manpower to make sure everybody is make sure everybody has those credentials to get in. I know that you will be receiving a wristband for vaccine. That will be your. And I forgot to mention that this year's celebration is free this year. So the only thing that you need to get in is your vaccination, to to show your card. But when you show that card, the individual will receive a bracelet of some sort that will identify them as being checked, and you will be able to go in and out of the gate as like you would, pay for a ticket or whatnot. That is your ticket to get in the homecoming celebration. So I know that in another one of the questions, or in this particular question, the HIPAA thing came up. That doesn't concern that doesn't affect the Winnebago Homecoming Celebration Committee or the veterans, because they're not a health facility. That HIPAA is between the patient and the health facility. So if the patient themselves are showing us their card, that's not a violation. So just to kind of let you guys know that that's not. It'd be like you know, I mean, just like you showing your ID. If somebody was requiring you to show your ID at the gate, then that's what that is. So there's no violation there whatsoever. It's just our way of making sure that, because we're trying to keep everybody safe, and I know there's everybody has their own opinions on that, and I guess that goes into the next question also, doesn't it?
Yes, there's a question about if it's against HIPAA to show the vaccine cards, and also about teenagers and forcing them to get vaccinated with them worrying about long-term side effects. So, and Mona, feel free to comment on that as well from the health department's standpoint.
Yeah, just like Les indicated, if a person wants to gain entrance into certain areas, like just for instance, they were just doing that at baseball games before things opened up, that it's not against HIPAA. That's your right to share your personal information with whom you choose. Now, if a member of the medical staff were to start telling people about who's vaccinated or who is not, excuse me, then that would be a violation of HIPAA. So it's really up to you on who you want to share your immunizations with, and that's your health information.
And also, the Winnebago Veterans Association and the Winnebago Homecoming Celebration Committee is not forcing anyone, or they're not promoting to get vaccinated. What they're telling you is that being vaccinated is a choice. It's a choice that you make, just like you get up and choose what you're going to wear, you know, for the day. But it's a choice, that it's an individual choice that you make for, you know, you and your family to attend the homecoming celebration. I have you know, acquaintances in 4 directions, and they're eager to come here because of what we're offering. What we're offering is we're offering a safety net, knowing that other people that are vaccinated can be around other people that are vaccinated, which is low risk, and is extremely low risk for our 11 and under. And so I don't know where the community read that the veterans were forcing people to get vaccinated, or even the tribe. I'm not going to speak for the Winnebago tribe, but just in general, where anybody's being forced to be vaccinated. It's a choice for you to come to attend the celebration fully vaccinated, or we will be streaming the homecoming celebration online, YouTube, and whatnot. So.
Awesome. Thank you so much, Les and Mona. Mona, with some of the questions, they concern the Delta variant, which I know a lot of people have seen recently in the news, and some reports too of it being detected in Nebraska. There's some rumors about if this one is effective against the vaccine. So can you talk a little bit about the Delta variant specifically?
Sure. So there have been 13 cases identified in Nebraska of that specific variant. Of course, the CDC is dubbing that as a variant of concern. So scientists are still studying it, but they're seeing possibly an increase of transmission, which may lead to maybe a more severe cases. But vaccines, treatments, the tests are still being researched, and being conducted, such as they've been doing on all the other variants that have been surfacing since the first one showed. So we just have to continue to vaccinate for those that wish to go down that path, and we will see what this new variant and the efficacy of the Pfizer vaccine, which is the one that we do here in Winnebago, what that effectiveness will be. So we just have to wait and see. But of course, with the other ones, it has, proven that it's been more effective, depending on which one variant it is. So, but vaccines protect you at least for some of it. And so it's not a catch-all. So it doesn't protect 100%, but it does make sure that, or it's been shown to lessen hospitalization and the symptoms. And so that's really what vaccines have done for us throughout time. We can look back at the polio and mumps and rubella and some of the other vaccines that were new at one time. And so we just have to constantly just keep educating ourselves. And so that's the most important thing.
That's great. So what I heard, Mona, is that vaccines continue to be our best defense at COVID and all of its variants. So great news. And Les, will the Delta or any of the variants affect the powwow?
Just like the the regular COVID virus, affected everybody. We'll continue to promote the homecoming celebration, and then if that arises, we'll consult everybody on this forum here. We'll consult everybody. So, like I said, we usually follow whatever the health department and 12 Cleanse tells us or advises us to do, and that's as far as we can go. But we're looking to celebrate next month, and that's where our minds are.
Great. Thank you, guys. And last question, and Danelle, I know you touched on this a little bit, but maybe if you reiterate. So there's also been some discussion about the hospital receiving funds from the American Rescue Plan. And people have been asking what the plans are, and somebody even asked if we were going to build a new hospital. So can you touch on that again?
Sure. Thank you, Emily. As I had mentioned before, the hospital is receiving funds, or well, not just the hospital, but the Winnebago Comprehensive Healthcare System is receiving funds from ARPA. And so far, the pot of money that's been made available to us is designated for those five specific areas that I had mentioned. So it's not completely unrestricted, and we are still going through a planning process right now to actually determine the budgets and how we're going to specifically allocate those funds. It's not likely that we're going to be building a new hospital, which would be quite an undertaking, and we already do have our hospital facility here. We have identified lots of need in terms of space and just repurposing space and better use of space. We've been talking quite a lot about that throughout both the hospital and the health department. So we are looking and hoping that we'll be able to do some facility upgrades and potentially some renovations in certain areas, but no specific determination has been made yet as to what that will be. But as we finish those decisions and that process, we will provide further updates and information about it.
Great, thank you. And I know there's been a lot of questions with regards to the American Rescue Plan too. And then I know the Winnebago Tribe of Nebraska has been holding a lot of community forums and has a survey out there asking community members how the money should be spent and getting their input too. And I believe there's one tonight, if I'm correct. So you can find all that information on the Winnebago Tribe of Nebraska's Facebook page as well. And I do also want to remind the community that we are continuing to give out the $15 Hy-Vee gift cards for any tribally enrolled member who can get their vaccine or comes to the COVID vaccine clinics. The gift cards are available every Wednesday at the COVID clinics that the health department is hosting from 9 to 11:30, and you just have to show your proof of vaccination card. Even if you get one COVID vaccine, we obviously want you to get the series, but if you come to get your first one, you can get that $15 Hy-Vee card as well, and that can be used for food as well as gas. So even to help you get to the COVID clinic could be helpful. So come get that. And we also, lastly, will be closed. WCHS will be closed for the July holiday, for the 4th of July on Monday, July 5th. Our emergency services will continue to be available, our essential services as well. But I did want to mention that since this will be our June update and we won't be updating again until July. So continue to submit your questions to covid@winnebagotribe.com. Continue to call the Public Health Nursing Department for your COVID vaccine at 402-878-2258. And we will see everybody at the next update in July. Thank you all for your watching, and thank you everyone here for participating.
Thank you.
A little bit of technical difficulties, but we did it. All right. Thank you all.
All right. Thank you.